Hello, and welcome to episode 11 of Root Causes, a Not My Generation podcast.
The podcast that hopes to bring a national discussion on the differing intersections of the fight to end gun violence. This is your host, Addison Moore.
And Elijah Nichols.
From DC.
Welcome to Root Causes.
Today, we will be discussing mental health, gun violence, and necessary reforms with Nia Jones and Andrea Brown from the Black Mental Health Alliance.
Welcome, Nia and Andrea. How are you both doing today?
Super excited to be here. I know Nia will chime in, but couldn't be a more perfect day to have this discussion. So thank you so much for allowing us to participate.
Ditto. I'm super stoked to be here and having this, what I think is going to be a really dope conversation. So I'm ready.
Why don't you both introduce yourselves for us and for the listeners as well?
So I'm Andrea Brown. I'm the executive director of the Black Mental Health Alliance, and I have the absolute privilege to work with a talented team of consultants and therapists and practitioners and community of people who are looking to be well. I've been here a little bit over 140 days, so super excited about that. And I do the countdown not because I'm bored, but because it has just been amazing. So thank you again for having me.
And again, my name is Nia Jones. I am a licensed social worker here in Maryland, and I'm also one of the amazing team members of the Black Mental Health Alliance. I also am an entrepreneur. So I own a human resources consulting company as well as a wellness company, all based here in Baltimore.
That's amazing. Wow. Thank you both for introducing yourselves and everything. So are y'all ready to dive into the questions?
The real deal is, are you ready for us?
You know what? That's a great way to segue into these questions. So what has both of your experience been working in the mental health field and specifically working with and serving Black individuals and other marginalized individuals?
I think I'm going to let Nia lead on this one, but I will say that we in the Black community are always the most underserved, the most needed, for a variety of reasons, not because we're not brilliant or resourceful, but just because of inequity. And so I think Nia will really be able to speak to, obviously drawing from her own practice, about what that looks like, the difficulty in reducing the stigma about mental health. And how do we do that so it's not, oh my God, you've got this problem. No, oh my God, I've got this brilliance and I need to treat this. And so I will share with you, Nia. I'll let you take the floor on that one.
Sure. So I have been in the mental health space my entire career in a couple of different ways. My bachelor's is in psychology. And so I initially thought I was going to go into health psychology. I was looking at health disparities and how it impacted people of color, specifically Black people, and went to work for a major research institution and realized that in the research, we were looking at faith-based communities and how mental health would show up specifically for parenting skills. And we also did a lot of work around intimate partner violence. So I was a part of the team that coined the phrase intimate partner violence here in Baltimore. And I realized that, we were doing some really amazing work looking at how intimate partner violence and mental health had an impact on the care for babies. So your development from being inside of your mom, so she's baking you, right? And then when you have the baby, right, it's an actual human walking around. And so we would actually look at their developmental markers and saw how intimate partner violence had impacted that child. But it wasn't just intimate partner violence or just, faith-based institutions. It was really what came up for me was that there was such a stigma around mental health. And so we know that 1 in 3 African Americans who struggle with mental health issues will ever receive treatment. And so that is incredibly low. And it wasn't because they didn't necessarily want to. It was usually about, again, stigma, which I always describe as disrespect, right? So it's ultimately, I came to you with a problem. I told you how I was feeling. And because you couldn't see it on the outside, you lessened it. And you lessened my emotion and my concern when I came to you. And so in that work, I saw a continuing of disrespect by clinicians. So psychiatrists who would see patients in a hospital and really have the approach that Black women were just sad. They were just, dependent on welfare, and they were just sad, and it was going to be okay. We were going to give them this gift card and they were going to be fine. I had seen children in the school system who were just angry, right? And to be Black in America, a lot of times, is to be filled with rage and depression at the same time. And so forgive them if they're upset and they come to school angry because of all the systemic barriers that they had to experience. And so I've seen it in the school system. I've seen it in hospitals. I've seen it in employment. And so I did a 9-year stretch in human resources around recruiting individuals who would actually educate Black and brown children. And found that there was, again, another issue around mental illness with individuals who were degreed, right? Like these were the teachers that were going to be working with young people, and still the same mental health concerns were coming up, regardless of how much money they made, where they lived in the city, who their parents were, where they went to church. It didn't matter. It impacted all of those brown people that I worked with across intersectionality almost the same. And it always went back to this issue of stigma. I went to someone and I had a concern. I was feeling sad. I was crying. I was angry, and they didn't, care to help me. And so in this 15 years, which at this point sounds crazy to say to me, it's wild. I hate saying the word crazy. It's wild to say 15 years in this industry, but seeing consistently that Black and brown people don't get the service that they need from a mental health and a healthcare perspective, because mental health is health, right? Your brain and all the chemistry that makes it up lives in your body. It's not like this purse that I carry. It's in here. And so continuing to see that same thing show up over and over again told me that I needed to be able to approach mental health in a totally different way in order for it to actually work.
Could I just add, it's funny as we talk about this stigma, that just didn't happen. That's plantation based.
Mhm.
It comes back from, shh, don't tell master, or shh, don't tell the other slaves. And so we carry that with us. And so this whole notion of not telling isn't because, we just made it up or because we're this prideful people.
Mm-hmm.
It is plantation based. And so we see that whole notion of keeping silent is really rooted in structural racism. And if we're going to be honest, we say, well, Black people are so quiet and silent. That just didn't come from us. That was because it was ingrained. And so, as I was listening to Nia share, and we talk about the stigma, and we talk about, how do we reduce that? And we talk about, being sad, or, women being sad, or Black angry women. That just didn't start yesterday or the day before. That is plantation based.
Yeah, for sure. I think about Kenya Barris's show Black AF, and every episode starts with "because of slavery."
Yeah.
And so many things for Black people, including our mental health, goes back to that dehumanizing experience. And so from that, and that same structural racism, and a lot of the research that was done on especially Black women during that time spoke to how they were seen in the health industry, right? So I said earlier how Black women are seen as if we can handle more pain than others. And then I think about, a lot of the obstetrics, the advances that they made in that area of the medical field was because of the Black body. And so I see those barriers in medicine. I see those barriers in how people can get access to mental health treatment. And that goes back to like research numbers, that goes to, how our people actually get their insurance, right? So does your insurance even cover it? And even when you actually have insurance, is the wait list a mile long? A lot of times Black people are looking for a therapist, a psychiatrist, a counselor who looks like them. And so then it looks at access to providers. And so it's not just stigma, it's also access. And so if only 5.3% of the active psychology workforce is people of color compared to 83.6% of white people, I'm going to be stuck on a wait list over and over again because it's going to be hard for me to find that person who can identify appropriately.
Oh, I just wanted to say thank you. I really wanted to say thank you because you're spending this very limited amount of time that you have as a practitioner, as someone who's engaged in these mental health spaces. So thank you for taking some of that time to educate us, to be in community with us, to really be in community and to help educate our listeners as well. So I just wanted to say thank you for your words and for spending this time with us.
You're welcome.
I think both of you touched on this in your responses around the different ways as to why Black and Brown individuals can't access or don't access mental health services. Could you both, if you can kind of dive into and explain what those barriers are and what they look like and name them? Because I think sometimes people think it's this invisible force field of why people can't access mental health, but there's actually tangible reasons as to why. I'm curious as to how both of you would explain those barriers.
So I think there are a couple of things, inequity, again, there's the insurance issue. And so, one of the things that we've seen, and I know Nia will be able to speak to this, one of the things that we've seen is, it's great when people say, oh, COVID, just we can do telehealth. We have, and I mean, Black people and communities of color, is we have internet access to do that. And so we can't do all of that on our phone. And people often say, how is it you don't have internet access? Are you kidding me? Walk a mile in our shoes. Well, the notion of telehealth is exciting. It is. And it is such an opportunity for us to have access, provided we really have access. So we can talk about, obviously, limited insurance, the inability to have access to internet in a way that is meaningful, not just on my phone. And here's the other thing, the inability to have access to a therapist who is culturally competent. And so, Nia talked a little bit earlier about, if you expect me to talk, I want to make sure you look like me. And I want to make sure that you understand from a lens. And so even if you don't look like me, it is important that you have access to a culturally competent training so that you get to see through the lens like I do. And again, Nia will be much more engaging because she knows. But part of what we've seen and part of the outcry is because there really is a 911 out about, oh my God, how can I get access to high-speed internet so that I can talk to my therapist? And I'm not talking every day. I'm just talking about a weekly appointment or bi-weekly. So I think those are some of the barriers that we don't often think of, but are critical to what we do.
Absolutely. And all internet is not created equal, right? Like just because you have it doesn't mean that it can withstand mom being on a therapy appointment and son or daughter or, niece, nephew, whoever in the other room doing schoolwork. It maybe can't. And then your TV might also be on it, right? I think a couple of other barriers are I mentioned the wait list earlier, right? So at the beginning of COVID, I had a very small client caseload because that was what I could handle. And then, right, like we've been saying this entire time that therapists have been the most quiet essential workers during this time because behavioral health claims went up 300% in March. And so, yes, that there's more availability right now. I don't have to drive to my client. I can see them in telehealth, but then it's around, if I have 30, there's only a certain amount of hours in the day that I'm going to be able to see people. And so there's so many practitioners who are either burned out and unable to take on more clients, or they're just unable to take on more. And so you get stuck on these wait lists. And there are so many organizations that are opening as mental health providers that are really just in it for the money. And so I know specifically here in Maryland, you see a client for no less than 20 minutes, no more than 60 minutes, and you get reimbursement based upon that. And so people will either shorten a session or drag it out just for the compensation, which takes me to my next point around cost. So if I do not have state insurance, right? So state insurance is usually free to the individual who is covered by it. Their mental health services cost them nothing, right? And so I just bill the state essentially for their services. But if I have a self-pay client, those sessions can range anywhere from $70 to $140 per session. right? And so that's a lot of money, especially for someone who, if you're severely depressed, like I was at one point, I had to see my therapist twice a week. And thank goodness she was only $50 a session. And, I say that from a place of privilege. I recognize that. That was $100 a week for 90 days until she was able to help me right side my ship that I had to go see her. That's a lot of money. And now I'm at a place where my topic has changed. I don't need to see my therapist as often. But as a therapist, I still wasn't able to find somebody, and I probably was being picky. First of all, let's be real. But the second thing is, I went to I went to a platform. I went to Talkspace.
Mm.
That's $400 a month, and I only get a 30-minute session with the therapist. I get to text her whenever, but again, privilege because I was able to pay for that. But imagine, a single mom who probably really needs 2 hours or more per week, and is maybe working and has employer paid insurance and either has to pay the copay for mental health, and it's usually on the far end, or can't find somebody because of the cost. And I think the last barrier is really around, kind of, we talked about cultural competency, but that also speaks to research. So I've been talking about the census for a few weeks now, and
Mm.
how when you do research kind of at the macro level, when I do research and I perform the literature review, I get that data from the census. If we're talking about things that are for Black and Brown populations, and Black and Brown people don't complete the census, my research is going to be skewed. And so then how
Mm.
does an evidence-based practice actually support people of color if they're not reflected in the initial data? And so it's so much bigger than like this lack of access and inequities in the behavioral healthcare system is more than kind of the micro level therapist to client
Mhm.
experience. It also kind of reaches up in terms of, how money is allocated within our different states based upon this same data that comes from the census only every 10 years. And so we're talking about generational impact at that point.
You said something earlier as you were talking about, shifting from your regular therapist to sort of this open space. But, the notion of express therapy is frightening to me. And again, we say, oh, at least you get a little. But the challenge with that is in these critical times, and you get to see me for 20 minutes, number one because that's your internet, number one because that's what you can afford, but I shudder to think what that does for community. And I love what you led with, Elijah, about community. And I know you and Addison, that is such important language, because it really is. If I am a single mother, and what if I'm not, right? If I'm not a single mother, but I'm taking care of full household, I have a partner, all of that. The challenge is that is still, and I get 20 minutes. That's still not enough, but that's all I can afford. And so to be able to shortcut that concerns me about our long-term wellness and optimal well-being. So
Yeah, thank you both for talking about some of those barriers. It's interesting to hear too, because I experienced those as well when I was searching for like a mental health provider, and I think it's really important to highlight like sometimes being picky, Nia, because you said that like maybe I was picky, but that's like sometimes you have to be because this person is going to be addressing your mental health, and they're going to
Exactly.
be helping you with that, and to not feel safe and comfortable with that person. One, if you're paying for your sessions, then it will feel like a waste of money and a waste of time if you're someone who doesn't necessarily have the ability to. Because I'm thinking like from my experience, it took me over a year to find a therapist that not only respected my gender identity but also understood my racial identity, how that impacts my mental health as well. And because of that, it took even longer for me to get the help that I needed. And I think that that's super important to highlight as one of those barriers, that like it's not even just about, because you could get the therapist, you could pay for the sessions, but then if they're not going to be for you, then it's still a waste of time, and it's still a waste of money that people can't always afford, especially thinking of Black and Brown individuals being the ones who are doing a lot of labor, working 60, 70, 80-hour weeks, who can't really afford or have that extra income to be able to get even those 30-minute sessions, which again, like you said, Andrea, it's not even worth sometimes that 30 minutes because it's just not enough time to be able to tackle the things you might need to in a session. So I really appreciate both of you sharing those different ways, how folks like the barriers they're experiencing when accessing mental health.
Something I want to add, it seems as if like with these discussions that we're having, not only from this episode, we've sort of realized and had this arc really in the, had this narrative for lack of a better term, but this truth really of how there is the commodification of well-being, the commodification of health, the commodification of internet access, of communication really. And I think as we look at lists like, yes, me as a white person, working class, low income white person, I've had everything in my life commodified. However, it is not to the extent that Black individuals have that, because from the extent to which America was really conceived as a nation, there's always been the commodification of Black movement, of Black health. And so it's really quite interesting. I think it's a quite imperative within gun violence prevention spaces that we internalize that struggle. How we have to decommodify health and well-being, how we have to decommodify internet access. We have to decommodify movement at the end of the day. I really appreciate like touching on that and seeing that it comes up nearly in every single episode.
Absolutely. I always tell my clients that finding a therapist is kind of like going shopping for bread in the bread aisle, right? Like there's a ton of different brands and flavors and colors of bread, and you find the one that works for you. And that might take some time. And I tell them that on the first session, like, don't get stuck with me. I might not be the right person. But back to that 20 minutes thing, it also, it's a very kind of like thinking about building community. My client caseload is 99% Black women and girls. I have one Black man. So 100% Black caseload. And it takes 20 minutes just to get through the, how you doing? How the children doing? What's been going on? Oh, your back's hurting? Okay. It takes at least every client without fail, 20 to 25 minutes to get through that. And then they'll go into the thing that concerns them. And so again, yeah, concerned about if we make this express care commodifying mental health, right? Like, are we really getting to the root cause? No pun intended.
I like that. Good stuff. You know, Nia, if I could just add, and certainly we won't hijack this, but you raised something about your caseload about, 99% women, and then there's this one, the one Black man. And, that in and of itself is another issue. How do we make sure that our men and boys are healthy, and they understand the truth about therapy and not the shame that could be associated with it? And, Addison, you said something that we live by, and that is this notion of safe space. We've got a number of things that we do around that, emancipation circles, and Nia, again, can speak to those. But when we start talking about a safe space, that's another thing. If you think that the brothers are just going to come out just because you say so, that's not going to happen. If it took him a year and he was willing, what about those who don't think that they need it? And they do, because here's the other thing. If we do this right, if the narrative around therapy for Black men and boys is messaged right, then we get the opportunity to liberate a generation of boys and men that we had not been able to do so in the past. But it's got to be right. It can't be the express. It's got to be in a safe place. And they have to have access. And so that they get to have access in a way that they had not previously. So, I just wanted to raise that because, when you think about Nia's caseload, and that's just one, I suspect that hers is probably more of the norm than the exception. And so if we see that, then how do we reach ailing and hurting men and boys, Black and brown?
So we and Not My Generation, we really internalize this struggle and this idea of the collective liberation of all people. But we don't use that as sort of like a shield to acknowledge the disparities in the certain historical like levels of oppression that have come towards certain communities, specifically Black and brown communities. And we know, because the data is very, very clear, that Black communities are typically hit the hardest from the reality of gun violence. And that's partnered with a low investment into community services like that of mental health programs. So can both of you sort of discuss how that access to mental health resources in Black and brown communities, how that intersects with the fight to end gun violence? Because I think it's an important conversation and it needs to be had more, really.
I didn't think I would have a chance to talk about this, but a few weeks ago, here on my street, right? So I'm sitting in my house on my street. One of my neighbor's sons had committed a crime. I don't know what it was. And he had done something else behind that. The first crime, he had served his time. He came home, he done something else, and decided to essentially hide in his mother's house. And for 3 days, for 36 hours, our entire street was on lockdown. And couldn't go out to the store to get food, couldn't leave the house. And so in that moment we were like, what's going on? Like we keep hearing gunshots, there's tear gas, there's a SWAT team in the middle of the street. And we're like, what is going on? Eventually we hear that it is my neighbor's son, and he has a mental health concern and a gun, and he has shot at the robots that have come into his house, and they are having the hardest time talking him down. And so he didn't get the help that he needed when he was sent away. In my family, they call it on vacation. He was sent away on vacation, and didn't get the help that he needed when he entered into the prison system, and came out and still lived with this mental health concern, and had access to a weapon. And so the team here in Baltimore was amazing. The SWAT team and the police, they were very kind and calm with the guy. But it still begged the question of, you know, his access to mental health treatment while away on vacation, or for whoever's listening, that means you're away in prison. While away on vacation, and then again when he came home, he was never rehabilitated. And so again, like it brings up this issue of access to mental health services, because why wasn't he helped? And then at this point, he has totally endangered the lives and the livelihoods of everybody on this street. And so it is baffling to me, the lack of access that people receive when they've been institutionalized from mental health services. It's usually a lot of psychotropic medication, and so it turns you into a zombie rather than, again, dealing with the actual issue. And then, you know, him actually having access to a weapon, and being able to get that so easily, whether it was, you know, registered or not. He had access to it and actually shot at the robots that they sent inside the home. But he clearly wasn't in control of all of his mental faculties, right? Like he was hurting, and the only thing that got him out of the house was his mother. And so I think about the lack of mental health professionals who are able to help individuals like him, when they've been institutionalized for something either petty or not, right? Because let's be real, there is a school to prison pipeline, and you know, not getting rehabilitated after being sat down, right? Like a lot of times our transformation happens when we are sitting still. You mean to tell me that we couldn't transform somebody who I'm sure the state was profiting off of? We couldn't give him some mental health support, and then he still gets access to a weapon. So I don't know what his diagnosis was, but a lot of times what happens is individuals who have access to these types of weapons and have a mental health concern are a lot of times either diagnosed as bipolar, because that's a really easy diagnosis to get, again, reimbursed from. And so as an adult, if you live with major depression or you live with bipolar, diagnosed as bipolar, especially here in Maryland, it's easier to reimburse for an adult with that, in addition to substance use. And so an individual that is bipolar or depressed or is actively using a substance also has access to a gun. And how does that keep us, like, baffling? Again, can you hear it? It's in my voice, I'm confused by it. And so individuals don't have access to a quality person, even if they are, you know, sent away on vacation, in addition to those who are actually still on the streets, actually here in Baltimore, that are living with substance use disorder and still have access to a weapon. And so it is, again, back to that 20-minute session thing. Like that was how I was trained. You have a 20-minute session with an individual who was living with major depression, or they are diagnosed as bipolar. And so that gives me concern for, how safe people are, because a lot of times what comes with that is suicidal ideation. Individuals who live with major depression, such as myself, usually suicidal ideation marries itself to it, because the pain is so deep that the only way that you feel like you can escape from said pain is through ending your own life. And so if I have access to a weapon, especially for men, we know that they are more likely to experience death by suicide with a firearm. And so someone who has that type of diagnosis is still able to have access to a deadly weapon, and not the appropriate treatment that they deserve. Again, baffling to me. But I pass it off to Andrea.
So Nia, come on, why don't we just be honest? I mean, and I think you have been, but I think we scratching the surface here. So for two things. So I like the example that you raised about your neighborhood. Okay, and so what recently happened. That's all true, all of that. But here's the other part. How about when we just think they're bad and they don't even have a diagnosis but need one? Let's talk about that, right? And so as a result of that, because we've never stopped to think maybe Marty is sick. I mean, maybe he has a mental illness, but instead he's just a badass. And so he's got access to this, he's got access to that. And because of that, he's never diagnosed. And in his mind, he's like, I think something could be wrong, but perhaps it's not, right? Let's just start there. So let's talk about how we don't even acknowledge early on that there's an issue. And then when we do, there is the absence of trained practitioners who can go with the squad, can go with SWAT team. I mean, is that so hard to have somebody, honestly, who is trained in this field to be able to talk to him and say, you know what, maybe he's not being a badass, he's sick and he has access to a weapon. So if we're going to be honest, I think we need to talk about how it is easier to say, oh, so-and-so, something's wrong with them, instead of saying maybe they're ADHD or maybe there's something else going on. So here's the other thing. Let's talk about the situation in Rochester that happened, three months ago? I'm shocked because I have a mental health issue and diagnosed, and people know that. And so we're talking about, this whole notion of, and I think what you saw, Nia, I think that's just going to heighten. I think that we are really on the brink of seeing this, almost crash and burn as, people who have mental illness have access to guns. And again, I want to talk about the Black community, but when we think about Emmanuel 9, I know that boy had a diagnosis, had to come in. I mean, not just because he was racist, but I mean, there was a major condition. And so I think that, Nia talked about the penal system and how it has failed over and over again, but I think it's done that by design. If we're going to talk about the school to prison pipeline, that is all by design. And so now here we're left with the mess to clean up. And so I think that, I could go on and on, but it angers me to know that there's lack of support in juvie for young people who are there, lack of support there. And so we just, oh, he's just bad or she's just bad. No, she's sick. And I don't know that I answered your question, but I think that we've got to be mindful about what's by design. This is all by design.
For sure. I had another thought around anxiety, right? So our bodies are naturally wired for fight or flight. And so I think about individuals who carry to protect themselves and their communities, right? And so this need to feel safe in a space where we know that if I call 911, I may end up dead in a situation where I was just trying to protect myself. And so, could it be, and I'm not talking about folks that are just going out here hurting people because they think, I'm a badass, right? I'm talking about individuals who, may have a mental health condition, may also be really anxious about being Black
Mhm.
in America, and, this need to protect, kind of in the midst of all the trauma that's happening around me. And so, what is to be said for individuals who, get caught up in gun violence because they were trying to protect themselves? And so I don't know. I might be thinking a little too out of the box as it relates to that, but I put that on the table that
Mhm.
there are so many people in our neighborhoods, Black and brown neighborhoods, that live with anxiety. And so, what is it that has happened structurally? What is it that has set in our DNA? Again, going back to our enslaved ancestors, what is it that has really changed how we see protection or lack thereof, and caused individuals to be caught up in these situations? And then we have to have things like a ceasefire, for example, here in Baltimore, because folks were trying to protect themselves.
Mhm.
Um, but it all goes back to this issue of anxiety, mental health, and either I fight or I flee. And it may look like something against somebody who looks like me, but how deep seated is that anxiety to the point that I turn on my own brother or my own sister?
Nia, and again, I promise you, we are not trying to hijack this conversation, but it is so interesting and so deep. Nia used this fight or flight. Anxiety was never my issue, except now I am the mother of this brilliant Black 16-year-old boy who is perfect to us. But when he leaves here, he's a target for them. And so now I'm anxious. And so I certainly won't go on record talking about how I deal with that anxiety. But what I will say is that you come for us, I promise you. I don't want to lose my job. But at the end of the day, quite frankly, there's got to be a diagnosis now for just being Black. It's probably code 222 something else. But and because they say what's the insurance code? I think it's DCM. You know better than I do, Nia. So it's like 751. Maybe that's narcissism. I don't know. Maybe that's bipolar with schizophrenia. But now there's gotta be one, because I'm a Black mother. Gotta be one.
Yeah.
And so quite honestly, I feel like when you start to talk about gun violence, I almost feel like it is my right and my privilege so that I can protect my amazing Black son to be able to carry a firearm. And if you get in my way, I promise you, you have heard it here tonight, that it is on. But I think that is what people are feeling. And this isn't even about being poor. This isn't about being any class. This is just about being Black in America.
That was a great mic drop, honestly. And also, I just want to say, like, don't apologize for taking up space in this conversation. I think both of you have really amazing, like, points to bring up, and it's brought a lot of value to even just some things that I hadn't really thought about exactly. I'm a Black person, and I hadn't thought about how that Blackness has really impacted the way that I interact with the world. Like, I know, but I didn't I haven't put it into words. So I think that both of you have added some really beautiful things to the conversation. Something that y'all mentioned that I think it's really important is that, like, sometimes the violence that I think people like to associate with Black people is because of these systems that they have put us into in order to need to be violent. Like, I think I do youth development work as well, like outside of my work with Not My Generation. And an interesting topic that's always brought up is, like, why would a young person kill over a pair of shoes? Well, even though, yes, it is a pair of shoes, it's not about the shoes itself. It's about everything surrounding the shoes, the value of them, what that means as your status as a person in society. What does that mean with community? What does that mean? And when you're thinking of young people specifically, these things that we are like, oh, it's just a pair of shoes. As you get older, it's like, well, no, it's not. It's never been just about the pair of shoes. It's never been about the object. I feel like when we don't look past the surface, we end up just ignoring the actual problem, which when we really perfectly named this podcast. When you get to the root cause of an issue, that's when you end up seeing work being done. That's when you end up seeing something fixed. It's like how this past year, the young girl I feel so bad because I cannot remember exactly where, but she was diagnosed with ADHD and had like some behavioral problems, but ended up going to jail because she didn't, because of not being able to finish her homework. And I'm like, we're in a pandemic. Are you really thinking like homework is the priority when mental health is on the line right now? Like people are stressed out about multiple things. Also, already having those diagnoses and being a Black woman navigating the world, that's only going to make it worse. That's only going to put it into perspective of like, oh, well, you're just angry all the time. We just need to fix the anger, when it's like the anger was never the issue. It's not the people that are angry. It's the system that they're put in that's making them angry. And I think that, like, y'all have mentioned that before. And I feel like that's definitely important to talk about when thinking of mental health. But I do want to go to our next question because I think it's really valuable thinking about this. We've talked about access a lot in this conversation, but we even mentioning it in this conversation that access is still not enough, because you can get to therapy, but what are the barriers that, especially when it comes to our healthcare system, there are still a lot of barriers that people face. I want to know what your all's perspective on, is free at the point of view single payer a necessary choice, which will cover mental health programs and treatment, so thus in these disparities to help in gun violence, or do you think our current healthcare system in America works?
I think there's very little in America that works. So just be
Yeah.
clear about my thinking. But one of the things that we are reading collectively, a book called Why We Can't Wait by Dr. Martin Luther King. It's written many, many years ago. And it actually was written from his jail cell in Birmingham. And it's called Why We Can't Wait. And so while much has changed, much has not. And so one of the things that he argues is 300 years of humiliation, abuse, and deprivation. It really cannot be expected that we find our voice in a whisper. And so, yeah, I think there are many things that are broken, but I think, she will probably have some insight as a practitioner. And again, because she sees it all the time. So Nia.
Yeah, I think it would work, right? In a perfect world, it certainly would work. And we've seen it work overseas, right? So we know that that option would work. But I don't think people are going to get out of their own way to do it. Because again, because of America. It's a tangled web of intersectionality, right? So if I give everybody access to the best cancer specialists, right? And the best mental health providers, how do I then decide, who's better and who's not? And so it's bigger than, will our government just pay for everyone to get access to what they need? It starts to ask questions around, like, really starting to shake the foundation of everything that our country kind of sits on. And so I think about a conversation that Andrea and I had with an individual a few months back. He talked about his struggle with being bipolar for a very long time. And he lived in a Black community across the country, and talked about how he could never find the right help until he came into some money. And with that money, he was able to get a support puppy. He was able to have an amazing therapist that he saw at least twice a week. He was able to actually pay for some of the self-care practices that he needed to engage in. He then had time to journal, right? And so it's bigger than, do I get the access to actually go to the person? Because now you're bringing up, like, if our country decides to do that, they then kick up a lot more dust around, well, my zip code then doesn't define whether or not I live, right? Because we all have access to the same care. My skin color doesn't define, my life expectancy anymore, because we all have access to it. I can then get my support puppy. I can then, access those self-care options that I wasn't able to afford because I was paying out of pocket for all of the treatment that I needed. And so would it answer the question? Absolutely. It would help generations to, undo a lot of the oppression that we've experienced with our mental health. But the reality is, I'm not certain that this country will pull that lever. And I don't, I can't live in that world,
Mhm.
unfortunately. And so it's caused for, people like myself to really approach mental health in a different way and to advocate differently for it. But yes, I'll pay more taxes if it means that everybody gets access to a really great physician. I don't know if it's going to happen.
But
Mhm.
here's the other thing, Nia. I think it goes back to what we've talked about. And I know, you initially talked about the school to prison pipeline. Let's be clear, this is all by design.
Mhm.
It really is. So even it not happening is by design, and it's strategic. It is strategic. Sadly, it is strategic. So I agree with Nia, obviously. Yes, it would be great. But I'm not fooled that even this is part of the grand design. Can it be changed? I think, absolutely. The revolution is coming.
Yeah, 110%. I think like tying it back to Not My Generation and the work that we do, our sort of perspective and our theory of change is we push for exactly what we want. We say we're not budging. Like we take it from our ancestors, we take it from those that have organized before us. The more you sort of give on your demands, the less you'll get. So like we at Not My Generation, we strongly stand by the idea that we are pushing for this liberated world, and this is the type of system that we want to live in, understanding we're not always going to get that, and it's going to take a very, very long time. But I think there is that reality that yes, we're fighting for these big things, but it's also like you said, Nia, is it going to happen? Because this whole entire system has been rooted in the privatization and the hoarding of resources by white wealthy elites for the longest period of time. And it's like, will the white wealthy elites, will they basically give up some of their wealth for the even like small sense of like at least mindful liberation that can come with a single payer healthcare system and the investment into our communities? And it's like us begging the question, even at Not My Generation, we think, okay, like is electoral politics, is that's what's going to save us at the end of the day? Sometimes, like obviously we're going to use it as a tool, but if we really want these big, bold systemic changes, how can we get them as quick as possible? Because our communities are hurting now. And continuously, if we continue to allow for the narrative to be on like the access rather than really talking about extreme wealth inequality and who has that wealth, I think it's super, super critical that like organizers, mental health providers, and people who are engaging in like very justice oriented services, we need to start thinking about this, that like we have to be using every single tool to shift the narrative in this country, to change the United States of America to be a more liberated space. So I just wanted to throw that out there. And I appreciate both of you, what you have said about how, one, it's made by design, and then two, is this a possibility in our current political framework? It's something that I constantly ask myself. It's something Madison constantly asks themselves. It's something we at Not My Generation consistently talk about, because we believe that people involved in the movement, change makers, we have to think critically about every single thing, the historical implications of it, the structural implications, how it breaks down our communities. So I appreciate that it feels as if there's this common knowledge between all of us, and that we're in this community and we're talking about these things and we all seem to understand it, but we're still learning from one another. So thank you.
I loved what you just said, Elijah, and I think that there has to be a change of the guard, so to speak.
Mhm.
And so, not even from millennials. I think Generation Z is like, we're not here for it. But but it's going to take kind of like that, all of that old funk of our, all of that systemic racial funk to like die off. Like, I can't, there's no nice way to say it, to die. And for this next generation to be like, we're not here for this. We demand change now. And kind of going back to the why we can't wait, those are the people that make the change.
It's funny because you're right. You wait for them to die off, but let's be super clear. Some of what your son will see and some of what mine is seeing now is, maybe they will die off. But then you got these same those people have children that I mean, they stand by that. They believe it. And so I think again, it is about how do we change the narrative in such a way that makes sense. So that we are. And here's the other thing. I think we've got to get to a place where we hold people accountable for all that pontificating. Nobody wants to hear that. Where's the work? What does that mean? How do we change the policy? How do we change the game? So I think we've got to get to that place. So so I appreciate you saying that, but and again, I agree, race and class, all of it all matters.
We've had a really amazing conversation. So I just wanted to thank y'all again for taking this time. So our big meaty last question for y'all, when it comes to our larger discussion is, we've talked about these different systems and structures and how they really don't they devalue and undermine Black and brown health in a lot of different ways. But while we're tackling these larger systemic issues, what does individual and communal care look like?
So I think it's a couple of things, and I love that we would end on this, because we talk a lot in our space about radical self-care and what that looks like, and one of the things that we stand, that our silence won't protect us. And so that's not ours. It's Audre Lorde's. She talks about it. Well, she talked about it, and that was her coin. Our silence won't protect us. And somebody that we had some interesting dialogue talks about, number one, that our silence won't protect us. And so part of what we do through radical self-care is help people find their voice. And it's okay that it's not the voice that you want it to be, or even that it was created to be, but that you acknowledge that in this moment, I have a voice, and that we help people find it. I mean, that's wellness, that's radical self-care. And that we remember not to stifle our voices. I think that's part of it. And I think we do that as a community, quite frankly. And I think, again, I go back to the notion of radical self-care. And I think that also means, care for the community. I think that's a collective. It doesn't just belong to us.
So I love, again, ditto to the fact that I love that we're ending here, and the concept of voice is important. So I remember I said that 99% of my caseload is Black women. Most of them have experienced some kind of trauma, so sexual or otherwise. And so the first thing to go is always their voice. And so whether that is literally, I cannot speak about what happened to me, or I could never speak up for myself, to whether it was to men ever again, or to women ever again, or to people in places of authority ever again, because when I experienced that trauma, whether it was violence, or if it was rape or incest or whatever, my voice was taken away from me, thereby taking my power. And so this individual care is really around restoring the voice, helping the individual back to that ultimate mental health space of I'm able to cope through life stresses. And then that really leads into this concept of I am because we are. And so I am concerned because we are concerned. I think it was Malcolm X who said, when we replace the I with we, even illness becomes wellness. And so this communal care is important, because it stops looking at what's wrong with you, what's wrong with you specifically, and what happened to you and what happened to us. And then how do we effectively deal with that in a way that we can get to this place of radical self-care and really caring for our people as a whole. And so I look at, groups such as the Black Panther Party. They were painted to be these really inappropriate badasses, because that's been our word for this podcast, right? But they were really meeting a need. They were feeding the children breakfast in the morning. They were exemplifying, or really walking in this method of protecting ourselves. They were educating the children. They provided youth development work on the weekends. They were, doing this creative work and really using their voice again to advocate for what they needed. And they weren't waiting for anybody to bring it to them. They were doing it for themselves. And so I think that this communal care model is what, our communities need. I'm not saying that you have to, tote a gun to care for your community, but you can, give the kids some eggs and bacon in the morning, right? You can, be that therapist who's, there for people in ways outside of just caring for their anxiety or their depression. I tell people all the time, you got to think about the bottom of Maslow's hierarchy of needs, right? So at the bottom is food, water, shelter, protection. All of that is at the bottom. If I don't deal with the stuff at the bottom, I'll never be able to really care for you as a whole person. And so when we think about, the violence in our communities and the trauma that individuals are experiencing, that is the kind of work that will start to heal instead of putting a band-aid on it. And an F code is what you were looking for, Andrea. An F code is what you use to diagnose. An F code to give to the insurance company to say, hey, this person has depression, let's move on. It's really caring for each other in this communal way.
Yeah. Thank you both for answering that question, for giving us your true unfiltered thoughts. I think it's something that both Addison and I appreciate. I know I specifically really appreciate it because I learn so much whenever I have these conversations, specifically from this episode. Because while I know a lot of this stuff in theory, to hear it from two amazing, strong Black individuals who literally live this work, I'm grateful for it. And I sort of wanted to get it back, like, to you two as human beings, not just as beings that care for others. Since you both are very strong advocates for a system and a community and individuals that prioritize care and well-being, specifically for Black and Brown communities and Black individuals, how do you decompress as an advocate? Is there any tips you could give for other advocates? Of course, if you feel comfortable answering this question. I don't want to put either of you on the spot.
No, I'm glad you asked, because honestly, we talk about it often. I make sure I work out. That's important to me. Don't call me during that time. That is my time. And, one of the things that we've been doing as a collective, the team, doing these moments of meditation and mindfulness. And let me just tell you, it sounds silly, but it is important to learn how to be still. So that, number one, I don't have to hear my voice. And Nia always talks about shutting out the noise. How do we quiet from the noise? But for me, we do, a workout, whether that's prayer and meditation, which we've talked about that we do. And we are both, again, voracious readers. So I'm always reading because I really want to make sure my cup stays full so that I get to give it out. So I don't want to give from an empty cup. And so that's part of it. And then here's the other thing, acknowledging, you know what, on Fridays, we need to leave at 12 or we need not to come in so that we can be still. And whatever that looks like. And everybody on the team has different needs. And so if your day is, and maybe you don't need a day, but maybe you do. And how do we do that? And I think, again, it's about giving ourselves some grace, some space, and acknowledging that I need to be healed in this moment. And this is the way that I do it. And so, Nia, I will yield to you.
Sure. So from a mental health perspective, I think I've shared that I live with both anxiety and depression. And so I have to take my medicine and I have to see my therapist. That is without question. But in addition to that, I think my major coping skills are definitely reading. Andrea has really modeled, decompression. And so she did a very long stint with the NAACP, and that is like super, super duper advocacy work. Like they are the model, right? And so I'm sure she knows better than most people about like putting this cape on and having to fly into Flint, Michigan, or wherever there is unrest. And so for someone like her to say, hey, stop, take a day off, is important to me and has become a part of my routine. But before I met Andrea, it was really around creativity. So whether that was making jewelry or making T-shirts or painting or drawing or coloring. It's always something about color that is helps me to relax and to calm down. And then my favorite one of all is watching trash TV. So Real Housewives of insert state here. Um, Love it. What is it? Love and Hip Hop.
I love
All of
it.
them. I like whichever one is on. I'm watching.
I think especially when we're talking about mental health and being advocates, it's so important to listen and hear how people decompress, because I feel like how you just said, Nia, hearing how this person who's nonstop says stop, it can kind of put you in check to take care of yourself. And so thank you both for sharing how you do that. I think especially as Black women, it's really important to hear how you are decompressing in this world and decompressing in this work. I think that's also important to highlight. And I also just want to thank you both for taking the time to be here with us tonight. It was, to me, an amazing conversation. I think I learned a lot about the work that y'all are doing in a general perspective, but also just understanding in a deeper way of just how mental health, and especially when it comes to race, how they intersect, and how at that intersection, gun violence seems to always be a symptom of that. So I hope to continue to hear about the amazing work you're doing. I'm in DC, so I hope I can connect with you all in some sort of way. I just thank you again for being here. It was so amazing. Y'all are doing such amazing things. I'm just like, in awe.
I have to tell you, to both of you, this restores our faith and our hope in what is possible, because you have the pulse on what's wrong and then how do we help. I appreciate what you do. You are taking the mantle and sounding the alarm, period.
No, I really appreciate it. Any moment where you get to talk about the mental health and wellness for Black people is important to me, and so I'm grateful for the space and the opportunity, not just to talk about it, but to also know that we're doing this work daily. So thank you for having us.
Thank you for listening to episode 11 of Root Causes, a Not My Generation podcast, where we discuss mental health, gun violence, and necessary reform with Nia Jones and Andrea Brown from the Black Mental Health Alliance. Please join us next Tuesday for an episode on gun violence in the Latinx community with two very special guests.
In solidarity, Addison Moore,
Elijah Nichols,
Nia Jones,
and Andrea Brown.